Hello, good afternoon. I was at a wedding reception when I was told by the man sitting next to me that if I wanted health insurance, I should have kept my job. And this was after I told him that I left my job voluntarily in order to start a nonprofit organization to help middle and high school students, low-income middle and high school students, get extra educational experiences that they couldn't ordinarily get in school and that they wouldn't ordinarily have access to or be able to afford otherwise except for this program. So I had to make a choice when I decided to start Higher Learning. I had to make a choice between whether or not I was going to have health care or whether or not I wanted to start a program that was beneficial to these students and to the broader community. So I chose to forego health care. I had no health insurance. I still have no health insurance. And in order to continue to serve my students. Although the Affordable Care Act has helped some people to get access to care, it doesn't solve the problem. It doesn't solve my problem. I went online, I'm actually still too poor to qualify for any of the insurance plans under the Affordable Care Act, although I do qualify now for the Medicaid program under the new rules. That's only though because Maryland has chosen to go ahead and expand that. If I lived in another state, I would still be no further off, no better off. So still, the Affordable Care Act doesn't solve the problem. I also, don't know, the issue with Medicaid, was I saying Medicare? I meant to say Medicaid if I didn't say that. The other thing about Medicaid is that it's still a means-tested program, which carries stigma with it, people look at you differently, they see you as mooching off the system, so I do now qualify for Medicaid, but with all of the baggage that's attached to being a Medicaid person or a Medicaid patient. And again, it doesn't solve the problem that we have, which is ultimately that we treat healthcare the way we treat luxury items. We treat it as if it's some luxury item, like it's a cell phone plan that we shop for, or a big screen TV, or a nice fancy car, that the more you have and the more money you make, then the better plan you can get, and the better you can afford, and the better care you'll be able to get. And it shouldn't be treated like a luxury item, right? But for those who feel that the more money you have, the better care you should get, then there's nothing to be changed, right? We should keep going with the system we have. For those who feel like wealthier people deserve better care than poorer people, then there's nothing to change, right? We can keep going with the Affordable Care Act and with the system we have. In fact, the Affordable Care Act makes it explicit that the poorer you are, the lower the level. You get the bronze plan if you can't afford a gold plan, right? But if you feel that healthcare is a public good, not a luxury item, that you benefit when your neighbor is healthy, that you benefit when your community is healthy, not just when you personally are healthy. So if you believe that healthcare is a public good, then we need to change it. Then we need to change it and make it happen so that everybody, so it's paid for the way we pay for things that we consider public goods, like our schools, like our roads. We need to pay for it publicly so that everybody gets treated equitably with the same level of care, that everyone is treated at the same level, that we're all human beings and not seeking luxury items, but seeking something that's critical for all of us. So we can make it happen. There are all kinds of problems and everything, but when there are things that are important, we find a way to make it happen. And this is something that we can do and that we will do. So when Maryland passes a single payer system and we become hopefully the second state to do that, then hopefully other states will follow us. So when what happens with one state, then another state will soon happen nationwide.